Good evening, everyone. Welcome back to News Channel 5 Plus. We really appreciate you hanging out with us tonight here on our Medical Monday segment. We're so excited to get to all those calls we've already answered this evening. Lots of great questions coming in. We do appreciate you calling in and asking our experts this evening. So, Dr. Gautsch, let's kind of go back into those calls. We do have a woman on line one. Her name is Frida. And Frida, what is your question for us tonight?
My question is that approximately about 7 years ago, I had a total knee replacement, and now my knee crunches and pops and cracks, and so I went back to the doctor and asked him about it, and he checked it, and he said that it was so full of arthritis and scar tissue that there was nothing that they could do for it.
All right.
Wow. I'm sorry to hear that, Frida. You didn't mention if you were having a lot of pain with it or not. If it's just being noisy, then that's probably just some scar tissue that is formed, or sometimes the lining of the joint will actually kind of overgrow a little bit and start getting caught in the machinery. Now that can become painful, but if your x-rays still look good, there's a possibility that an outpatient arthroscopic procedure to go in and kind of clean up and tune things up could take care of your problem. I've seen it every once in a while. Some people's immune system is so sensitive that it can tell that that's artificial in there, and it kind of tries to build a little scar around it. It doesn't actually have any impact on the replacement itself. The replacement still functions very, very well, but that tissue can kind of get caught in there, sort of like little nubbins on the inside of your cheek sometimes that you bite down on, and that tissue can get caught. It's noisy, it can be painful, but it's usually easily relieved with a little outpatient arthroscopic procedure. So, I mean, that's guessing. Hopefully, your doctor gave you, the information that was good for you for that. Hard for me to know, but I mean, if you'd like, I'd be happy to take a look at it.
Wonderful. That's so kind of you. That's great advice, too. Again, we're happy to get to these calls tonight, so thank you for calling in, Frida. We appreciate it. Let's kind of go back to our guest this evening. It's really neat to not only have our expert in the house this evening, but someone you've actually had as a patient, which is Tammy joining us from Gallatin this evening. Let's go ahead and talk about, we have round 2 coming up soon, so I'll let you guys kind of take it away, what we're gearing up for, and maybe some more things you wanted just folks tuning in tonight to know about your experience with Tammy.
Sure. Well, I'll start off then, if you don't mind. A lot of times people will have a left knee replacement after they've had a right knee replacement, or vice versa, and because you've walked about the same number of miles with each leg, they've experienced not exactly the same, but very much the same, and we're all made out of the same material genetically. So, so the person who's most likely to see me needing a left knee replacement is often somebody who has previously had a right knee replacement. But I find almost universally that people move through the second one faster and easier. It's just that unknown. It's like going down any path that you've been down once before. You can go down it a little bit faster. But I think it would be useful to ask Tammy what she's doing with this knee now, maybe, and probably things that she wouldn't want me to know.
Yeah,
maybe,
what is our update?
I do whatever I want to do. I mean, it doesn't restrict me whatsoever. I wasn't prepared for the numbness. So I have grandchildren, and it's kind of strange when you crawl around on the floor, and actually it's not as numb as it was. It's slowly getting back to normal, I think, but I didn't know to expect that. But other than that, I mean, that's, and everybody.
You ride horses, right?
I do.
Your quality of life, I mean, did you feel like in a way you're gaining it back?
Like you said, I ride horses, and when I go to get up on the horse, I'll get up from the right side, because my right knee is which is the one I had replaced, is so much stronger than my left knee. Sometimes I just can't hardly pull myself up at all from the left side, but the right side I have no problems whatsoever. And yes, I get up and down off of ladders and up and down off of tractors, and crawl around looking for things. Whatever I want to do, it doesn't.
Well, it's a great
It doesn't hurt at all.
way to, let folks kind of, hear your story tonight, know that you have been through this, and your surgeon is sitting right next to you. I think that's just amazing that we have that here tonight. And we actually have another caller. We are getting so many wonderful calls tonight. We really appreciate it. We've actually got...
If I could interject just real quickly. So people will often ask me, what can I do with knee replacement? What can't I do? It really comes down to just a couple of things. I ask people not to run or jump on a knee replacement. Pounding, the same kinds of things that can make your natural knee wear out sooner, that pounding can make an artificial knee have problems sooner. So, but everything else is really pretty much fair game. So it's common that patients are, I take care of a lot of people who farm and are active, climbing ladders, getting on and off their tractor, taking care of cattle, gardening like I know Tammy does, horseback riding. People can play doubles tennis, you can hike, you can swim, you can bike.
Being a grandmother, that in itself is a full activity.
I've had several patients who have walked marathons with their replacements. I ask them not to run it because it's just, again, the pounding, but you can do pretty much anything you want to with it.
That's a pretty fair analogy of knowing that when you step away from that type of surgery.
It can be a little bit weird to have a little numbness around an incision. Anybody who's got a large incision knows that there's numbness on one side or the other of it, and it's just because the nerve fibers in the skin necessarily get transected when you make a surgical incision. But as Tammy's is experiencing, they will often grow back to some degree too. But it's common to have a little numbness around an incision around the knee like that.
Wonderful. All right, we'll go ahead and get to these next calls. Good evening. What's your question for us tonight?
Hi, thanks for taking my call.
I've
experienced knee pain for a number of years, but I guess my question is, how do I know when it's time for a knee replacement?
Oh, great question.
Thanks for calling.
And one that I hear a lot too. So I can evaluate the knee and tell you if it seems to me that it's getting worn out to the point that we need to do something. The somethings that we usually try are things that Tammy mentioned, and not everybody is happy to have them, but we'll often try arthritis medicine for a while. We'll try cortisone injections. There's other things that we can inject in the knee too. When people finally come to replacement, often they'll look back on those things and say, oh, well, that was kind of a waste of time because I ended up having to have a knee replacement. But for some people, it does help to push that off or even keep them from having it. So we will often try that, but it always takes place as a dialogue between the patient and the surgeon, really. Ultimately, when things aren't getting you to the level of function and comfort that you want, to live the life that you want to live, that's when we often will see patients come in and say, as Tammy did, we're going to stop fooling around with this. I need to be able to do things that I'm not being able to, or that if I try, cause me too much pain. So I just want to go ahead and have the replacement. It's the definitive thing. Injections will last for a while, months. Even if you get years out of injections or medicines, that's good. But replacements, last for decades. So it's kind of a personality thing, and it's ultimately not my decision. It's ultimately you, the patient's decision. I can tell you what the options are, and patients tell me it's time, or okay, let's try some of these other things first.
All right, great. Let's go ahead and get to our next caller on line 3. Can you hear us? Is it, I think we have Tina, is that right, on line 3? We will go to line 2 then. Can you hear us tonight? We'll take one. Hi there, who do we have on the line this evening?
Danny.
Hi, there we go. I'm sorry, can you repeat that for us?
Danny, D-A-N-N-Y.
Hi, Danny. Thanks for calling tonight. What's your question for us this evening?
I was wondering, why is it some people can run marathons years and years, and some people can't? And these people who run these marathons, they don't have knee replacement, don't have any knee problems at all.
Right.
Great question.
Yeah, that is a good question. And I don't know if I can tell you for sure the way that it is. My father-in-law, who sadly recently passed, was healthy all the way up until he got sick before he died. And he was a guy who would run 7 miles every day since he was in the Army. When I met him, and then until he was in his 70s, he was running 7 miles every day. And he didn't have knee trouble. There was a time in his life when he ran ultramarathons, so I know exactly what you're talking about. Some people do these crazy things and seem to get by with it. I think about it a little bit like I think about cars, right? So I've got a sedan that I take to and from work. It stays on the road. I try to avoid the potholes. I've got a truck that I take out and do things when I'm going off-road with. If I took my sedan out and did the things with it that my truck does, well, it wouldn't last very long at all. Some of us have got knee knees that are like Humvees, I think. You can put them through anything and they just keep going. And some of us have got more like, you know, Jaguar or Toyota knees, and they just don't hold up to what we ask them to do. Some people are lucky genetically. Some people have got a full head of hair when they're my age. I
guess
don't.
It's up to those good old-fashioned genes. So we're going to pause for one more quick break. Keep it right here. We'll be right back with those questions answered on the 5 Plus.